Big Money Bound TV. I'm a little too aggressive with that one. Hold on. I fix my jersey. Big Money Bound TV, RRT Posse YouTube. If you're new to the channel, please like, subscribe, share, turn on post notifications, all that good stuff. Now, if you're a returning subscriber, I appreciate you. Welcome back. You already know what's going on over here. Four is up, forever ambitious. Big Money Bound TV. And today, what we're talking about is respiratory therapists versus nurses. Is there beef between respiratory therapists and nurses? And if so, why is that? When did this start? What happened? What's the root of the problem? Is there even a problem? We gotta figure this out, man. We gotta get to the bottom of this.
What we represent, man?
Big Money Bound.
Say, let her know, man.
Big Money Bound.
First things first, I gotta open this up by saying, like, nobody is born beefing with each other. Nobody is born a hater. Nobody is born racist. These are things that you pick up and learn as you get older and grow. Nobody wakes up and say, you know what, I'm gonna be a nurse and I'm gonna hate respiratory therapists. I want to beef with respiratory therapists. Nobody's doing that, and vice versa. I sure enough didn't wake up and, hey, I'm gonna go be a respiratory therapist and I don't like nurses right now. No, I said I don't like nursing, what they have to do. I'm not grabbing a man's private part and sticking something in there. Yeah, I said that. Yeah, I did that. But that don't mean I got beef with nurses. They ain't sticking nothing in my. They ain't sticking me with nothing, so we good. So it's like, we gotta look at like the root of this problem, man. This is coming from the people that's bringing us up into the field. Like an example is, before you go to nursing school, a nurse will talk to you, yeah, man, it's a great career path, but you got a lot of other employees and coworkers that don't really listen to you, especially respiratory therapists. They don't like to show up when you call them for rapid response. They only show up when it's a code blue. They don't. So now you already getting preconceived notions that, okay, respiratory therapists don't want to work. Respiratory therapists don't like showing up unless it's a code blue. Then you got the respiratory therapy side, people telling the therapy students coming up, yeah, man, these nurses like to boss you around, and they can tell you what to do. I went to school for this, I know what I'm doing. They can tell you when to come and put in orders. They think they're the doctor and this and that. Whoa, see, now you get in your head, I gotta look out for nurses, look out for nurses. We fighting amongst ourselves, man. We hate ourselves, man. We all healthcare professionals. We all work in the medical field to help the patient's overall goal, which is to get discharged and get healthy. That's the goal. Why would I be beefing with somebody? Man, we gotta really figure this out. So this whole time, before you even started a program, became a student in the career field you want, whether that be nursing or respiratory therapist, you already got people in your ear saying something about the other side. You want to be a nurse, they're saying something about respiratory therapy. You want to be a respiratory therapist, they're saying something about nursing. So now, you finally get into the program, now you with a bunch of students who done heard the exact same things that you've been hearing. So now you're like, man, there gotta be some kind of truth to it. This gotta be right. Same thing for respiratory therapists. You're in the program, like, okay, dang, everybody saying this about nurses? Hey, man, maybe I need to look into this. Now you going into clinicals. Oh, man, don't get, and now you with somebody, you with a preceptor that's telling you about, yeah, man, they're on the phone with a nurse. Okay, I'll be there. Boy, these nurses are stupid as hell. Like, whoa. You picking all this stuff up, man. You just going by what you see. We got to lead by example. So, man, your preceptor is already talking dirty about the nurses. You looking at this as a respiratory therapist, and you're like, dang, the nurses must really be tripping. Like, what's going on with these nurses, man? Nobody never did nothing to you so far. You a student. Nobody said nothing wrong to you so far. You like, man, these nurses are crazy. They are tripping. The other end of that phone call, the nurse with her student. Yeah, I really need you to come up here and do this treatment. The patient is wheezing and doing that. Like, I need your help. Please come up. Click. Man, these therapists do not like the work. I'm telling them that the patient is in distress. He's wheezing. They do not want to work, man. You gotta look out for these respiratory therapists. They are lazy, all of them. You got off the phone with one person, you saying all of them? We gotta get down to the root of what's going on in here, man. Why are we beefing? He thinking one thing, you saying one thing. What the hell is going on with this thing, period? Man, we gotta figure this out, man. I'm trying to do a video of this woman out here frying chicken. She frying Popeye's chicken sandwich. She couldn't get her own Popeye's chicken sandwich in line, so she down there frying her own, man. Hey, Jody, you wild with it, man. So, yeah, we got to figure out what's going on. So I say, to begin with, it's the instigators. The people that's hyping your head up, making you believe something that's not really true or you don't really know. You already got preconceived notions from what somebody else has told you. So people just boosting up, starting trouble where there's no trouble already. Coming up to you, yeah, man, when you go into the hospital, man, just be on the lookout for the nurses, man. They don't like no respiratory therapists. You're like, what? Nurses, and then nurses telling the nursing students, yeah, man, when you go in here, just put these respiratory therapists in their place, because if you don't, I'm telling you, they will not work. They do not want to work. They're lazy people. So, hey, man, we got to get past the instigators. These people are tripping. Okay. Now, if we can get past that, once you're in the field, you got to be honest from both sides of the field, from both sides of that line, man. It's a line. You can't cross that line. From both sides of that line, nurse and respiratory therapist. Now, as a respiratory therapist, I have to admit, there are some respiratory therapists that maybe, you run across people that you maybe some ain't right with, dog. Yeah, some may not be right, man. I can see why people are saying that. Yeah, I can see why we getting a bad rep, because this therapist here, he kind of make me second guess, like, what you doing in here, man? But then at the same time, you nurses got to be honest as well. I'm sure y'all run across some nurses that you just think like, yeah, that one maybe have a couple screws loose. If I get sick, make sure they don't take care of me. You got to just be honest you got to be honest. So if you come across one respiratory therapist that you may not think is a good example of what a respiratory therapist should be, for whatever reason y'all have some kind of conflict, one kind of problem, that's what that one therapist. Don't take it out on the whole career field, the whole career path. Don't say every therapist, because bro, I'm cool and laid down, I'm down to earth, man, big money bound TV. YouTube, RRT Posse, I'm representing for my people. Now, at the same time, respiratory therapists. I know there's some nurses out there that's why I know, but not all of them. So when you come across that one or that two or that three, just let it be those three or those two or that one person. Don't make that the whole career path. Don't make that all the nursing, from the labor and delivery nurses, nurse anesthesists, the nurse practitioner, the charge nurse. No, just keep it with them 3 or 2 nurses. Don't make that the whole career path. That's what we losing at. That's what we making a mistake. We blaming everybody for one person's mistake. Can we ever clear up the beef between respiratory therapy and nurses? We may not be able to. But let's hope the generation behind us can. So all we can do is lead by example. Change starts with the person in the mirror. Change starts with the man in the mirror or the woman in the mirror. You got to look at yourself. Okay, man, I'm just go out here and show them that I'm a respiratory therapist or a nurse that can get along with anybody doing their profession. Anybody trying to make their money, go home, pay their bills, feed their family. It costs money to eat, and steak and lobster ain't cheap. We all doing the job. We all taking care of patients. Why would I come in here and really have a beef or a conflict in a white-collar job inside of the AC with security guarding the doors? Why am I trying to bring beef and where it don't need to be nothing? Like, bro, let's just relax. So that's what we got to do, man. Is it beef between respiratory therapists and nurses? Me personally, I don't have beef with nurses. Now, I probably may have a beef with a nurse, but not nurses. Nurses are cool with me. Ask around, man. Big money bound TV Randy, hey, they straight with me. Now, some of them may say something different, but the majority may say, nah, dog eye, he does his job, he getting his fetty, and I like his YouTube channel. So it gotta all start with the person in the mirror. Can y'all please drop some comments or some bad experiences that you had with a nurse or some bad experiences you had with a respiratory therapist? And what could you do to not let that experience dictate how you treat the other career path in the future? Please put those comments down. And hey, keep watching. Tune in every Monday, 12 o'clock a.m. Eastern Time. All that good stuff. Jody Joe, is the food ready? Yes. Huh? Yes. I'm coming. I'm finna go and eat, man. Y'all have a good day.